Hello, I'm Dan Duncanson. I'm an internal medicine and primary care physician at Simon Health, and I'm joined today by Dr. Justin Yancey, one of our neurology specialists, and we're going to talk a little bit about memory loss. So, Justin, is it accurate for us to say that as people age, they naturally lose memory?
There is some natural kind of memory loss as people get older. Generally, some simple things. So people may have occasional memory lapses. They'll forget where they put their keys. They'll forget where they put their glasses. But usually, it's not that frequent. It doesn't interfere with their daily life, and it doesn't really get worse as time goes on.
All right, so what is the difference then between just natural age-related memory loss and a diagnosis of dementia?
Like I said, some of it is kind of the degree. So, and usually with dementia, people get worse over time. So you have to kind of monitor how they do. And usually it's more severe things and they're more common. So they're repeating themselves more frequently. They're having more issues with daily activities. So managing their finances or following recipes or driving to familiar places, things like that become more challenging for dementia patients.
We've heard a lot about Alzheimer's disease over the
Mhm.
last decade. Is a diagnosis of Alzheimer's disease the same thing as a diagnosis of dementia?
So, dementia is a general term for a progressive memory loss that kind of affects your daily life. Alzheimer's is the most common type of dementia. It probably affects about 60 to 80% of dementia patients. But there are other types of dementia, such as vascular dementia, frontotemporal dementia, and Lewy body dementia.
Okay, so the increased amount of information we hear about Alzheimer's, is that because it's more common or are we just better at diagnosing it?
I think it's a little bit of both. I mean, I think we are better at diagnosing it now. Their tests are better, imaging is better. We have some biomarkers now testing for dementia. But I also think that that the population is getting older, and so there are more cases of the Alzheimer's. And right now, probably about 7 million people in the U.S. with Alzheimer's. That number is supposed to double by 2050 to about 14 million people.
Hopefully, I won't be one of them.
Right.
So, as a family member, and you mentioned family a few times, kind
Mhm.
of, what they notice. So, when is it appropriate for them to bring a family member or maybe a friend in for evaluation because they think it might be more than just age-related memory loss?
Yeah, no, I think family members usually the first ones to pick it up, people who see them regularly. But things that they notice, they're maybe repeating themselves more, maybe having more issues in kind of daily lives. So, say maybe mom forgot to pay her power bill, or she's having more issues driving to familiar places, or more trouble following a recipe, or things she's always done 1,000 times, but now it's becoming more difficult for her, taking her a longer time. That's something you have to be concerned about.
That's wonderful information. Thank you very much for joining
Absolutely.
us today.
Thank you.